Well, climate and health is, especially 20 years ago, was a completely emerging new idea, whereas air pollution and health had been studied extensively for several decades. And in fact, the air pollution issue had really been tackled sort of around 1970 when the Clean Air Act was developed by Congress, and that led to air quality regulations and research programs to support those air quality regulations. And there was sort of a big infrastructure of both government regulations and also university research going on related to air pollution. But the methods we use for that air pollution research, epidemiology, biostatistics, risk assessment, were readily applicable to the climate change field. But with climate change, there was no regulatory structure. You know, there were no laws about it. There was very little funding. So it was easy from a methodological point of view to make the shift. But the challenge has been at that time and subsequently, the challenge has been the fact that there's not very much sort of government support for the work. So even though it's really important, it's been hard to sort of piece it together to do funding in a soft money environment like public health schools like we work in.